Now it's time for tipisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Hello, Dr. Sadie. Thank you for joining me today.
Thank you for having me, Tanya.
We're so excited to be able to learn more about your use of Perio Protect. Tell us a little bit about you. You're a periodontist. You're on the East Coast.
Yes, I'm a periodontist. I've been practicing for 15 years. I am from Maryland, so went to Maryland Dental School and did a 1-year residency at the Miami VA hospital. And then I left to Philadelphia to do perio at UPenn. And I graduated in about 2010 from the perio residency at University of Pennsylvania.
And then you've been in private practice more or less, or you're a small group practice, right?
Yes. So I work in a fairly large multi-specialty practice where we have, several, maybe about 7 general dentists, 4 to 5 hygienists. And I work with some specialists like oral surgeons and endodontists and orthodontists. So yeah, we're a pretty comprehensive private practice in the Maryland area.
And we first met you towards the end of 2018 when you started testing out Perio Protect for your patients. What motivated you to implement Perio Protect in your practice?
So I first heard about Perio Protect in 2018 from one of the general dentists that I work with. I think he went to a course and heard about it and brought it to my attention and asked me about it. And then we both actually took the course on Perio Protect to see what it was about and, if it was something we wanted to implement into the practice since we're a very comprehensive multi-specialty practice. Um, so we tested it out in 2018. We started, cherry picking cases and we were doing them, very selectively using Perio Protect. And then we started using it more and more. And as we used it enough and had a large sample size to see the results, we started implementing it more and coming up with our own protocol in the office.
And it's expanded beyond the two of you.
Yes, it has. So we now are multi-location practice. We're 5 locations, and I'm also with another individual owner who has 2 to 3 locations. So we've expanded Perio Protect into all of our clinical practice, and it's a part of our daily treatment plan. So we have our own protocol and everybody's using it and everybody talks about it. Everybody from me being the periodontist to our general dentists, our hygienists. So it's, the main kind of maintenance that we use in our practice.
All right. So you have had about 7 years of use now and like, obviously it's changed over time and it expanded and it's become a clear part of your home care protocol. What do you wish you knew then when you first started that you know now?
So when we first started using it, I thought it was just for patients for scaling and root planings, maybe just hygiene patients. But I think as I started to see the results, I started to think a little more beyond that and how I would implement it into perio. So when we started seeing positive results with reduction in bleeding in gums and better pocket depths, I figured I would start using it for my perio surgeries. So I had to think, am I going to use it for their post-op healing? Am I going to use it during their healing or pre-op? So that's what I was trying to figure out. So now I have my own thoughts on how I use Perio Protect for perio surgeries like osseous extractions, implants, recession, and also unknown etiologies like burning gum syndrome or something like that, where no one's really able to pinpoint and they don't know what else to do. I've used it for cases like that.
With
So
success?
yes, we had a lot of success with just unknown things that were causing people gum irritation and no one could figure it out. And we probably had about like two of those cases in the last couple of years. And the patients loved it. We've also had patients who they thought they were going to need teeth extracted and they loved the Perio Protect a lot and they wanted to try it and see if it would tighten up the teeth. So we have patients where now they don't need extractions. So I think as I started to use it for different scenarios, I started implementing it for all my perio patients now.
So I know you and I've talked about how this helps with patient retention. Maybe that last bit of information that you just provided really helps explain that, right? When people can try to save their teeth or solve a situation that you're not even sure what the etiology is.
Yes. So I like Perio Protect for these situations. I think it helps with long-term maintenance, also maintenance in between cleaning visits. And like you said, for situations that we're not really sure what's causing their gum problems or irritation. And there's also, people on medications like
Yeah.
seizure medications and, we keep going in and doing gingivectomies and over again. And we put patients in that as well. And we've seen really, really good results with the Perio Protect.
How
Um,
would you what do you just how do you describe those good results? Do you just mean really healthy tissue? Are you seeing stippling again?
So actually, our post-op just came in yesterday. We keep following up with him. He's on anti-seizure medications and was struggling with a lot of gingival hyperplasia, very puffy, erythematous gums, rolled margins, loss of stippling. And so now what we see is he has very nice pink stippled gums, no rolled margins. It's defined papillas, and he can actually clean and floss. Um, and so it's done wonders for him. And now he's not having that recurrent hyperplasia that just keeps coming back due to the medications. And also, we had to make sure that these patients are implementing the correct brushing techniques too. I think when the gums are so swollen, bleeding, they tend
Right.
to lose sense of how they're supposed to use the base method for brushing. And then when they see their gums healing better, they're able to brush better. And so I think it goes a little hand in hand.
Yeah, I think it's so interesting once patients get a sense of how much healthier they can be, then you'll see and I've talked to lots of clinicians and I've talked to patients also say, "Now I'm doing the stuff I should have always done, but now I know it's working."
Right. It's motivating, I think, for the patients to see that.
Right, right. So your use has really changed over time. In the beginning, did you use Perio Protect for implant patients? Because you and I have been working a lot over this last year on implant patients.
I think I was very selective. I was only really using it if someone had periimplantitis or a failing implant. But now what I've changed, and this is what I wish I knew earlier, but now I've evolved where I'm saying to the patients, even before you get to periimplantitis or a failing implant, why not protect your investment and wear the tray to deliver this hydrogen peroxide subgingivally to the implant so that bacteria isn't sticking around your
Mm.
crown and titanium surfaces. So again, I think now I use Perio Protect as maintenance, post-op healing, which back in 2018 we did not.
That's right. Okay. The hardest part for clinicians who are just getting started with Perio Protect is case presentation. Now, this is so common for you and your teams that it doesn't seem like it was ever even an issue. But could you just briefly describe how you talk to patients about their need for this home care?
So when I'm talking to them about their disease, I tell them basically you almost become, if you have periodontal disease or you have deep pocketing, bleeding, you almost have to maintain your dentition. So I tell them you become a little high maintenance in the sense that everybody's used to brushing their teeth and flossing, but you need that extra adjunct to your care. What you need is, and I kind of tell them that this hydrogen peroxide, when it breaks down into oxygen and how it basically shifts the environment in the mouth to oxygenate it and kind of kill off the bad bacteria. I think they kind of get that. And I think when they know that it's a product that whitens their teeth, it's going to get reduction in bleeding, better gums, better health. That's how I talk to them about it. I tell them it's your maintenance. And honestly, I have some testimonial videos that I show to the patients. So I think that's motivating for them
I
if
see.
dentists are going to do a case presentation. But honestly, in all since 2018, I don't have one negative review from a patient regarding Perio Protect. They really like it and love it. And they give me recommendations on how they're using it and what time of the
That's great.
day. Yeah. So that's how I've evolved too, by getting patient feedback.
Well, Dr. Sethi, you're obviously a great clinician, listening to patients and taking, putting them first always. We are so proud to partner with you, and we just really thank you for sharing some of your experience with us today.
Thank you so much, Tanya. I hope that, everyone who wants to try the product out gives it a try and, see how their patients like it and how it works for them in their practice.
Yes, it is one of those things that people hear about, but it's not like something you can just try off of a shelf. That there is some effort behind it, and you and your teams have really done a great job and have served so many patients. So we just really appreciate you.
Thank you so much, Tanya.
All right, listeners, that is our show for today. Thank you so much for joining us. Be sure to reach out to all of our guests. Give us a follow on social media. Make sure you hit that subscribe button. And if you have a minute, head over to our website and sign up for our newsletter. All right, we'll see you on the next one. This has been a production of Endeavor Business Media, a division of Endeavor B2B.